So today's presentation is going to be on the body swing connection and how we can look to be able to prevent golf injuries that are caused by physical limitations. So my name is Dr. TJ McClurg, and I work at Personalized Physical Therapy and Wellness. And as you can see there, I am Titleist Performance Institute certified. So I spend a lot of time working with golfers. And the big thing we really look at is, how can we break down and identify ways to prevent further injuries and heal injuries that have occurred. So today's agenda, we're going to look and kind of briefly describe what the body swing connection is. We'll talk through some different relevant anatomy to the swing itself. A big component I want to touch on today is also going to be motor control, specifically with rotational activities. And then we'll discuss some different screening and injury-inducing limitations associated with that. And then, lastly, and the thing that I think a lot of people will be interested to hear about is being able to self-address some of those limitations. So we'll look at a couple different exercises that go through those. So staying on the course. So the British Journal of Sports Medicine had done a study a couple years ago, and they said that somewhere in the neighborhood of 70% of amateur golfers are going to sustain an injury while playing golf in their lifetime, which is a really very significant amount. And of those, nearly 40% are going to be low back injuries. So that is a real ton of golf injuries. And a lot of those are preventable through being able to kind of address and identify certain markers that are kind of high risk indicators for being able to have a low back injury while playing golf. Now, the body swing connection. So what this refers to is basically finding the link between our physical capability of performing a task and actually swinging the club properly. So there's a lot of ways to swing a club properly. And this presentation really isn't about learning how to swing correctly. It's learning about how to become physically capable of doing that task without putting yourself at risk of injury. Because identifying those physical limitations help to kind of understand why we're having improper golf mechanics that are also injury inducing as well. So that is what we think of, is that there is this kind of direct connection between the physical capability of performing a task and then being able to go ahead and do that correctly in a way that doesn't produce injuries. So one concept that I think is really important to understand is as we look down and kind of break down our body into segments. So down at the bottom, starting with the ankle, knee, hip, and then on our way up, you see that we're a series of alternating stability and mobility joints. And what we're looking at is a mobile ankle, a stable knee, a mobile hip, and then it should be a stable lumbar spine followed by a mobile thoracic spine, which is where most of our rotation comes from, which is very relevant to the golf swing. So what we tend to see a lot of times is that low back injuries occur, but they're not always the low back's fault. More times than not, it's because of lack of mobility in the hips or lack of mobility in the thoracic spine that increases the strain on the lumbar spine and thus creating an injury. So before we go too far, I want to jump into a little bit of relevant anatomy and talk through a couple of those areas. So starting from the top down, the thoracic spine. So you can see in red there, those are the 12 vertebrae that make up our mid-back. And their primary job is for rotation. Now they're able to kind of bend and extend or kind of back bend a little bit, but the primary amount of that motion is coming from our rotation. And really we should have up to 45 degrees in each direction. Given the structure and the support that it receives from the ribs and that we don't load bear nearly as much here as we do in the lumbar spine, the risk of injury is really fairly low. However, we see a lot of patients in clinic that are really very tight through here, and it leads to high risk of injury just in other places, particularly the lumbar spine. So if we go back, we look at those 5 segments down below the red that connect to our sacrum. That is our lumbar spine, and that's made up of 5 segments. While they do allow for some rotation, they're kind of the opposite of the thoracic spine. This is where a majority of our bending and extending come from, or back bending come from, this is a very high risk area for injury. So this is, like I said, 40% of golf injuries or so tend to occur at this area. Um, that is really a high number, and we're going to kind of dive into some of the reasons why that occurs. And the last thing I want to kind of draw a highlight to is the hips and pelvis. So we'll look at some kind of anatomical pictures, but before we look at anything else, as it relates to the golf swing, I want to look at both internal and external rotation. So these are really relevant, and you can see down at the bottom, hip internal rotation is the number one indicator of low back pain in golf, the second being side plank endurance. So if we look at picture number one, assuming this is a right-handed golfer, in picture number one, he is in his downswing phase. So his left leg is into a little bit of internal rotation, and his back leg, which the foot is pointed out, is into external rotation. Now, where it's really important and where we see most of the injuries occurring is in picture number two, where it would be simulating a backswing for a right-handed golfer. So his right foot or his back foot is in internal rotation, where he is kind of pointed outward relative to his toes pointing in, and he is in external rotation in his left foot. Now, this is really critical because in your backswing, so if your backswing leg, so for a right-handed golfer, your right leg, if you have limitations to your hip internal rotation, like his right foot in number two, if he wasn't able to achieve that, that would be the number one indicator that we have of someone being able, eventually occurring low back pain. And the reason for that is something we'll dive into a little bit more, and that kind of relates to our topic on reverse spine angle, but that hip internal range of motion is really critical in golfers. Now, as we look at the muscular anatomy, we can see how closely the lumbar spine and the pelvis are tied in together. You have a lot of muscles that connect between the two, specifically the iliopsoas, which is one that comes into a role. So I wanted to kind of highlight that muscle because that's going to come into play later. And especially for all those people that spend 40 hours a week sitting at a chair, you know. Sorry, I got a question here from Bobby. From the previous slide, can you explain how there can be, this was from a couple slides ago, many good body swings? So basically, if you watch anyone on tour play, not one person is going to have the same swing as someone else. You see some really funky swings, anywhere from Jim Furyk to a more pure swing like Adam Scott may have. But realistically, the important thing is they start at and they get to the same place consistently every time without creating excessive torque on structures. So it's really not about the mechanics of the swing as long as they're not painful inducing mechanics. And that's something you can really talk to your golf pro a lot more about, because they are going to be more in tune with, the performance side of getting you to where you need to be, where this really, the intention is getting you to the health side of where you need to be to prevent and correct any kind of injury inducing mechanics. Great question. All right, so some common swing flaws I want to talk through. So the big four are going to be the reverse spine angle, early extension, our S posture, and then the sway slide. But before we get into any of those, I really want to talk through some motor control, because that is really a critical component of that. So what is motor control? It's the process of initiating, directing, grading, purposeful, voluntary movement. So think coordination. That is really kind of where we're at with that, is our ability to coordinate and sequence our body through a series of rotational motions. Because the golf swing, really, if we think in larger terms, it's everything from the hips through the shoulders, but realistically, every joint in our body is moving. So we need to be able to kind of regulate this very essential motion to golf, which is rotating. And the way we really try to dive deep into that is looking at how do our hips and our lower body turn separate of our trunk. So proper control is critical, but we need to be able to dissociate. So that is, like I said, that's the ability to separate your upper body from your lower body. Because if you're not capable of doing that, you're going to look like the Tin Man swinging, where every single kind of mechanism all happens at once. Where if you can more effectively learn how to recruit and utilize the muscles of your hips and pelvis, you're going to find that you take a lot of pressure off your back. You're going to find that your sequencing and your timing is better, so you have a lot better consistency in your swing. And then you're also going to find that you develop a lot more power and you're able to hit the ball a lot further because we're a lot more efficient with the swing. So when you're unable to dissociate, you end up doing the exact opposite, where your performance is compromised and your risk of injury goes way up. So one way we take a look at screening for that pelvic motor control is through this dissociation test. So you can see me demonstrating here. What I'm looking at is, can you keep your shoulders still while rotating your hips? I do a decent job of that, but it's still not great. I certainly can improve with that. And what you can identify is, if you have someone with you, if you try to attempt it without them holding on, and then you secondarily have them come and hold and stabilize your shoulders, you should feel that it feels no different with or without support. That is our ability to use our hips and to control and coordinate our hip rotation without our trunk moving. Because if we can't do that, then we're not going to be able to properly and effectively swing. Does motor control come with swinging more? Not necessarily, because if you just go out and play more and you reinforce bad habits, then we actually could be creating more lack of motor control, because we've just developed very discoordinated and uncoordinated patterns. So that motor control, and specifically pelvic control, comes from drills just like I demonstrated there. It's a way we test it out, it's a way we try to identify. But there are a lot of different ways to train the motor control, and it is one that tends to get lost a lot. We immediately think of, I need to get more flexible, I need to get stronger. But coordination really needs to have its place within that training program as well. And that's really a good way to identify that. So now as we look, I like this picture because if we think of the golf swing, you can kind of begin to appreciate just how complex it is with how many muscles need to be firing, because we talked about the coordination component of it, but realistically coordination is that proper sequencing and firing of muscles. So if we have this many muscles all involved, it takes a lot to properly sequence and coordinate them. That is really, really important. Bobby says he would like to have muscles like that. I agree, Bobby. All right, so the reverse spine angle. So this is important, and any golf lecture I talk about injury-inducing swing mechanics, this is one that gets included because this is the most common cause of back pain in golfers. So when I talked about that hip not being able to rotate, your trail hip or your backswing side, if you are unable to get to your full backswing, you're going to be unable to fully rotate your trunk without backwardly leaning or kind of arching back towards your target. Nearly 40% of golfers demonstrate this, and I don't think that it's a coincidence that nearly 40% of golfers develop low back pain. This is a tremendous cause of low back pain. So if you can eliminate this, then you can be very effective at treating low back pain and preventing low back pain as a golfer. So I've got two pictures here. The colors are a little backwards, but the picture on the left here is someone that is demonstrating reverse spine angle. You can see that that blue line is pointing more towards the target than away from the target. He overextended, overarched, and the right side of his low back is at a real risk of injury as soon as he enters his downswing. Compared to the same swing on the left side, or excuse me, the right side, where that angle of orientation is away from the target, he is able to stay loaded and coiled on his back hip, and we have kind of created space available in our lower back to not worry about overextending those facet joints or compressing those facet joints as we come through our swing. So what are the physical causes and the reasons this happens? Well, we talked pretty extensively about the internal rotation of the trail hip, but the three we didn't talk about is that thoracic spine that I mentioned at the beginning of the lecture being tight, so not being able to rotate the trunk would cause us as a kind of a reasonable expectation for side bending instead of rotating. Tightness in our lats, which is the muscles that run from kind of the lower part of our shoulder down to our lower back, what we kind of calls our pull down. If they're tight, they prevent us from reaching back overhead, which is kind of the end point of our backswing, or just weakness or lack of motor control for a better explanation. In our obliques or on our trunk, because we're not properly sequencing and stabilizing ourselves and our movement patterns are off. So sometimes it may not be that I physically can't do it. It's just that I physically don't control my emotions well and I find myself in a bad injury inducing position. So as we transition from that, what I want to look at is our hip internal rotation. How do I know if I don't have enough internal rotation? I've got a test for that. So I've got those set up to cross each other in a 90-degree angle. The golf club is directly across the front side of my hips. And what I'm looking to achieve there is rotation with my foot planted. And I should be able to match or exceed the club that's on the ground. So that being my lead hip as a right-handed golfer. And then as I go, you'll see my trail hip, which we discussed is the most important. I should be able to exceed that, which I'm able to. Now you got to make sure that that club stays pressed into your hips and you're not cheating the last 25 degrees by tilting the club just to make it be a number that you like better. So say you come up and you're about 10 degrees short. The next question should be, well, what do I do about that? Well, I've got a stretch for you. So this is a hip internal rotation range of motion stretch. We're reaching up with the opposite leg, pulling down, and you're going to feel probably a little bit of a pull across the front side of the hip, and then hopefully a large pull across the back side of the hip. Now, there's value in doing this both ways and proactively stretching your hip internal rotation, and it's one that I do regularly. It also is one that if you are specifically tight on one side, really should be an area of concentration for you and spending more time. We'll show that one more time here. So I see the comment about having knee pain with this. No, you should not have, and I assume that was with the test, but no, you should not have any knee pain with either the test or especially not with the stretch. Sometimes with the test, since that joint is loaded and we go to create some torque on there, that may be an indication that there's a knee pathology in play and something you probably want to get checked out. But realistically, there should be zero pain with this stretch at all. All right, so we talked about our oblique strength. So this is a side plank. I'm sure most people have seen this. So holding this for 30 seconds without compensating or dipping is really what we're looking to achieve. And with this, the best treatment is the test itself. So you can do side planks, but if you're not able to hold them for 30 seconds, and as we discussed earlier, that is a number one, actually, I should lie to you there, a number two injury inducing mechanic. But here's another way to be able to address that. So we have what we call our Palloff press. So I'm doing it on a cable machine, and that is going straight out from my chest directly forward. Now, if you don't have a cable machine just sitting in your basement, doing this with a TheraBand is another great way to be able to do it. But it's what we call an anti-rotation exercise. So as I press forward, my obliques on my left side are working really hard to keep me from rotating back towards the cable machine. So I'm basically learning how to stabilize my spine without actually having to move the spine. That's one of my personal favorites. All right, so I saw there was a question about the difference between strength and motor control. So strength is kind of your ability to move an object. So that would be whether I put 100 pounds on this pallet press or 10 pounds on the pallet press, I would have to have greater strength to be able to achieve that 100 pounds. Motor control, however, is your ability to kind of properly perform that with good, smooth coordination. So you may be able to do it with 100 pounds, but if you don't have proper motor control, then your strength is really for nothing because your ability to properly perform, stabilize, and control that action is really what's more critical than just adding more weight on. So they really go hand in hand, but are not the same thing. So with this, we're looking at both strength, but as we go in a slow, kind of controlled fashion, that coordination of motion is what we are looking to achieve there. All right, so next up, we have our thoracic rotation. So what we're looking at for this one is how well can I rotate without being able to side bend. And this is what you should keep an eye out for is if you don't rotate well, then the chances are you're going to excessively side bend. Now, I'm not a good example of being tight because I actually have really good thoracic mobility because I practice a lot of this. But we have what I have is a 6 iron down on the ground, and then an extension from that, you can pick any other club. But it's important that it's a 6 iron because that creates that 60-degree angle that we want to be able to see how much we're rotating there. So if I'm rotating to my left foot is down, I'm on my right knee, and I'm going to be rotating towards my left side. And I should be able to clear past that 60-degree mark. And you'll do the same thing on each side and be able to kind of tease out, am I tight to my downswing or am I tight to my backswing? If you're tight in either direction, that is absolutely something that should be addressed. Not only is it injury inducing mechanic, it is very limiting for your ability to hit the golf ball with any kind of distance if you are not mobile in your thoracic spine. So I've included a great stretch for that, and this is going to be up against the wall. So we are looking at our back for right-handed golfers, our backswing rotation range of motion with this stretch here. So left foot is against the wall, left knee is against the wall, and left foot and shoulder are, excuse me, hip and shoulder are against the wall. And what you'll see with that is I actually give a little bit of a hitch, not as much on the second repetition, but the first repetition where I try to lean a little bit. So we call these book openers, but you want to end where you are opened up and really rotated through the thoracic spine. Let me show that one more time here. All right. So the third swing flaw we have here is S posture, and this is demonstrated in nearly a quarter of it. But what we're looking at is kind of an excessive arch or curve of the lower back that creates this kind of S like the line is drawn on his spine. So butt is out, belly is dropped down, we got a big arch in the back, and that is a really kind of tough position to find ourselves in. So it tends to result from the combination of what we call lower cross syndrome, but specifically tight hip flexors and weak glutes, which in today's population is a lot of people because we spend a lot of time sitting where our hip flexors get shortened and our glutes get kind of weak and inactivated. So this is a really important one. As we talked about that motor control, if you don't have great strength in your glutes, then it's going to have really tough. You're going to have a really tough time having proper motor control of anything else through your spine. So the abdominal strength, the glute strength, the hip flexor or iliopsoas flexibility, and then kind of tension in the lower back are critical for this because that is how not only do we get to our proper spinal positioning, but it's what it's going to allow us for proper hip and pelvic mobility and control. So if we think back to that slide I showed where I was keeping my thoracic spine and shoulders still and just rotating my pelvis each way, I have to be able to be flexible enough in my lead hip flexor to rotate that way. And I also have to be strong enough in my left glute to be able to kind of coordinate and fire the motion in that direction as well. So this S posture is a pretty common one we see, not just in golfers. We see it a ton in the clinic. So being more flexible, standing up more, doing more exercises for your glutes, learning to be more mobile through your lower spine, all of that is really, really critical to kind of preventing that excessive arching and injuries that occur with that excessive arching. So how do we look at glute strength? Which I haven't met too many people that pass this test with flying colors, but we're lifting up into a single leg bridge and holding it for 10 seconds. Now, I didn't hold it for 10 seconds because I know when I get to about 6 or 7, I start faltering. So I am what would be considered a fail on this glute bridge test. But we'll show that again, with the only caveat being once you get up into that position, you need to hold it still for 10 seconds. I've included the golf club across my hips because that is a good way to be able to kind of demonstrate or isolate. Am I dropping? Do my hips kind of shift? Am I rolling or kind of rotating to one side? All of those are kind of instances where we expect to have some kind of glute failure or fatigue that is kind of indicative of a injury inducer and also a kind of performance prohibitor as well. All right, so we've got improving our glute strength. This is one of my favorite golf exercises because it is a great glute strengthening exercise. And we also have a motor control component to it. And then we also have a thoracic rotation component of it. So all of those things we talked about are important to address. We kind of have combined into one exercise here. So it is a reverse lunge with a twist. So I'll show you a couple. So there's a lot of glute work coming from the reverse lunge. There is the thoracic rotation component, which is pretty clear and obvious just from watching the rotation. But the motor control part, and I probably should go even kind of slower than I do in this video, is that we have to be able to learn how to use our glutes while turning our trunk. Because my hips aren't significantly rotated in that position, that is really all coming from my thoracic spine. So my glutes are engaged, but steady. And that was actually a good example now that I watched this back again. If you watch the first time when I go back, my hips stay totally level and stable. And then back, my left glute, my knee falls out. So my motor control on that left side is not as good as it is on my right side. So that's something to kind of be able to identify for. But this is a great exercise to be able to take a look at that kind of on each side. So I have a question that, is this for the front leg or for the back leg? Well, both legs are working, but realistically, the leg that steps back is not working as hard as the leg that stays planted. So there, my right glute is working more. And then there, my left glute is working more. Great question. I like to do them alternating though. All right, so the last one I have here is early extension, which is standing up too quickly. And we've all seen somebody that does this. This is primarily caused by tightness in the hamstring, but what happens is because those hamstrings are tight, you're not able to hold your technique. So as you come through on your downswing, you start standing up a little bit early, which forces our club face to stay open. And you tend to see this as a push. So for your right-handed golfers, that's the push off to the right, and vice versa for your left-handed golfers. But this really all boils down to kind of tightness in the hamstring, which most people probably know if they're tight in the hamstrings going into this, but we're going to kind of break down and show what that looks like. So that is me screening my left hamstring. So my left foot is on the ground. I'm bending my right knee because I want to see not just are my hamstrings tight, but specifically are my hamstrings on the left side tight. So leg is straight, hands are overlapping, Can I go down and touch the toes? I'm just short of that, so I'd be a candidate for being able to do that. Now with this one, you obviously want to be able to test on both sides. Now, assuming you're like me and you are tight in your hamstrings, what are we going to do about that? This is a very golf specific hamstring stretch. So I have my left leg up on the bench and I'm going to be slowly rotating to my downswing side because that is where I need to be flexible. As we saw that person standing up early in their picture, they need to be flexible really throughout, but especially at their point of contact, because that is when the tendency to want to stand up is. So you need to be able to rotate toward your downswing side with that leg up. So it's not that the right leg's hamstring flexibility for me is not important. It's just not as important as the left side is, because that's where it's ultimately going to kind of negatively impact your position at the point of contact there. Let's show that one more time here. All right, now how do we put this all together? So the role of physical therapy in all of this is we need to be able to see, to be able to identify what's going on and why is that a problem? Is it that your thoracic spine is immobile? Or do you have poor coordination that leads you to just not properly use your thoracic spine? Is it, hey, these segments in your thoracic spine move well, but these ones do not? And this is how we more kind of accurately kind of identify and treat and assess what's gone wrong there. Hey, is there something going on that's blocking your ability to be able to rotate the hip? Is the capsule tight? Do you have acetabular impingement? Are you just really tight in the muscles of your hip? So based on those evaluations, we're able to determine the best course of action. And through that, we implement different techniques like joint mobilizations, soft tissue treatments and mobilization as well, muscle energy techniques and proprioceptive neuromuscular facilitation techniques, where we are training the kind of nerve muscle complex to be able to be kind of more susceptible to motion, and also be able to help kind of garner and gather that motor control like we talked about through neuromuscular education. And then obviously there's an exercise component through progressive therapeutic exercise programs. So it's a really kind of well-rounded approach. But the important thing is being kind of effective and efficient with the evaluating of why am I not moving properly? How is that creating injury inducing mechanics? And how do I get out of pain? And then it's our job to come up with a program that consists of these methods to be able to implement that. Now, one thing we do like to offer is to all of our kind of members that join these workshops is an exclusive offer that we kind of limit to the people that attend here. So what that includes is a pain and lifestyle audit, future roadmap to pain-free living, our report of findings, and then our home body rejuvenation program. And along with that, we have 24/7 access. We have kind of live and updated feedback, and then real-time adjustments on your routines. So that is a $350 value. And for these workshops, we are available to offer it at $99, but we limit it to just 3 people. So for any of you attending today, if you have any interest, please contact me and let me know, because we'd love to get you in for an evaluation and be able to do that. And so, yes, it does involve a golf movement assessment. So I like to, when I see my golfers, I really have a two-headed approach. I like to do a full comprehensive head-to-toe evaluation that is screening physical limitations. And then I like to be a little bit more targeted and specific in doing golf-specific evaluations with movement patterns that are kind of most specific and pertinent to you as a golfer. So we're really looking at all of it. So we're not missing anything, but we also are coming in with kind of the focus in mind that, hey, I'm a golfer and I want to be able to play golf effectively and efficiently. So we look at both. So that's a great question. All right, it looks like we have one more question here. You'd like to sign up. So the best way to go ahead and do that is You can reach out to me with whatever's most convenient for you. So my email address I'll put in the chat box here is Dr. TJ, DRTJ at personalizedptw.com. My phone number is 336 408 8224. Either one of those are great ways to reach out, and we'll be able to get you set up. And so what we'll do is we'll get a sense of what's going on with you. We'll get you in for an evaluation, and then we'll get you feeling better. Okay. So if no one else has any questions, we'll go ahead and end there. But I appreciate you guys attending today. And like I said, if you have any future questions, please don't hesitate to reach out through my email, through our phone, through our company website, and we'd love to get you back healthy and on the golf course.